months of negotiations, nearly 5,000 Providence frontline healthcare workers took to the sidewalks today to demand a number of critical changes before heading back to work. Fox 12's Dylan Scott is live outside of Providence, St. Vincent, and Beaverton with the latest tonight. Dylan.
Riel, good evening. We're now about 10 hours in. As you can hear and see behind me, this strike is still going strong. I'm going to step out of the way here and give you a live look. Dozens of nurses and clinicians making plenty of noise about what they say are unfair labor practices. So much so that it's caught the ire of Governor Tina Kotek and others. Meanwhile, Providence says right now they're focused on their patients and quality care to the community.
So we're taking care of more and more patients with fewer and fewer staff. You have to put a stop at some point. It becomes unsafe.
Robin Richards is an OB/GYN physician and among the dozens of frontline healthcare workers taking to the pavement on day one of the Providence strike, asking for a fair contract that includes safer conditions, better pay, and a boost in staffing.
So it's either Providence needs to cap their patients and create ratios that are safe, and those need to be codified in a contract for both nurses and doctors, or you just need to hire more nurses and doctors.
From sunup to sundown, picketers will continue to make plenty of noise at 8 Providence hospitals across Oregon. One supporter isn't a medical professional, but is standing all day at Providence St. Vincent to support those who supported his family when they needed it most.
And they're both alive and well and healthy as can be now. And it's all because of the gals that worked in there and saved my grandson and daughter's life.
But let me be clear, this is not a game. It's not a war of words. People place their lives in our hands every day.
Jennifer Burrows, chief executive for Providence, Oregon, says that's where their focus is at the moment. Hiring additional employees, including 2,000 temporary nurses, to continue to provide critical services as these negotiations wage on.
But I want to express my gratitude for those who have stepped up to help us minimize disruption for our patients.
However, Governor Tina Kotek believes that disruption could have been avoided with a heightened sense of urgency. In a statement saying the healthcare provider waited too long to start negotiations, it is now urging both parties to return to the table quickly for the benefit of all Oregonians. The governor added that she was aware of a Providence internal policy to not return to the table after receiving a strike notice. Fox 12 followed up with Providence, who says they share that desire to negotiate, but have been working to prioritize the stability of their clinical operations first. Meanwhile, medical staff members we spoke with say they'll be back out here tomorrow and the day after. In reality, they hope to never have to leave these facilities or their patients, if possible.
We don't want to leave, though. We want to stay. We just want to make it right.
Now back out here live, we've also reached down to other nearby healthcare providers such as Legacy, Kaiser, and OHSU. Their spokespeople tell us they are prepared to take on an influx of patients if needed due to these strikes. But right now, most say they haven't felt that type of need. In Beaverton, Dylan Scott, Fox 12 Oregon.